went slowly, which is good. All right, so yeah, whenever you're ready, feel free to start.
Perfect. Well, hello everyone. Thanks for joining us today. My name is Vachon, and by training, I'm a radiologist. I've been a radiologist for the last 15 years or so. The last few years, I've been quite involved with artificial intelligence in radiology and helping find breast cancer and lung cancer and those kinds of things. I've helped train and test algorithms and deploy the systems into hospitals and health systems. So that's pretty much what I've been doing. I still do a little bit of radiology as evidenced by the giant computer behind me here. So Monday, Tuesday, Wednesday, I still do some clinical radiology, diagnostic radiology. So I look at CAT scans and MRIs and ultrasounds and make my reports, and they're sent to the various hospitals around me here in Southern California. The purpose of today is to answer some of the common questions that I've gotten with some of the groups that I work with. A meta-analysis can be a bit daunting because it's a lot of data. And so that's why I just wanted to use this particular journal article as a way to start the process. So we're going to talk about 4 things today. Who is it for? What's the intended audience? How do you pick the inclusion and exclusion criteria? Once you have that, what kind of data do you even start to look at? And then how do you get started? So this is intended for people who are either going to get started or have been struggling with starting, and this is a way to kind of regroup and get it going. So the first question, the intended audience, so this one is from JAMA. And so if someone wanted to submit to JAMA, there's going to be some set of criteria. And if you want to submit to some other article, there's another set of criteria. And so it's important to go to the website and say, like, what do they need? What is the literal size of images? What is the size, like in like megabits and pixels? Like it's going to tell you like how to do that. It's going to say what's the word maximum, what's the word minimum, what are the things that need to be in the abstract, and what are the parts that need to be in the body of the study. When is the deadline? How many authors can you have? So like all those things are on all the journal websites. And so make sure you understand what the intended audience is so you can kind of plan for that at the beginning. I've had many times where I've had a thing ready for publication and I go back and I see that my images were too small or too big and I need to figure the whole thing out and reformat everything. So I would highly recommend to have 1, 2, or 3 of your target places to publish and look on their website of what they require. Now, if it's for a local research fair, great, but also still know, like, do they expect you to be in a poster? Do they expect you to be PowerPoint? And you can kind of use that to guide you at the beginning. So the next big question that I get is the inclusion and exclusion criteria for the meta-analysis, and even specifically bringing up the Prisma chart. And so if you have one of these, right in front of you, it makes it a little bit easier to say, like, where do you even start? And it doesn't have to be exactly like this, but it has to have some sense of where they kind of came from, and then like, what did you take out? And so once you kind of get to this in mind, you can have 3 boxes up here, or 4, or 1, or it doesn't really matter. But like, how did you search, and where did you get them from, and then how did you start taking them away? And so you can see they've looked in 2 different places, and they had to take out some duplicates. Got it. And so that gets, they do the math, they get subtract down to 612, and then they had to exclude other things for whatever reasons, and they take those out. And then they finally get to the ones that they're going to include, which in this sense is only 15 studies in 19 publications. And that's been another specific question that people have asked. How many studies is too few and too many? And the answer that I always give is, you can explain it away in the discussion. So having said that, apparently JAMA was okay with only 15 studies and 19 publications. That seems a bit on the low side to me for JAMA, but this is also the JAMA open network, not, possibly not their published one that goes into the article. So I think that this is a very helpful model to follow. And then lucky for us, they also picked a couple other things in here where they said, how did they decide if they were going to include something? And they give a little chart here showing you guys have the link, you can look into here, but how long they followed it for and how they defined adherence. And this is adhering to lung cancer screening. So getting CAT scans of your lungs to see if there are lung cancer there. And so that's the whole point of this study, was to see how well patients stick to it. All right, so we already talked about the intended audience and making sure that you're set up to succeed. The next one we talked about was how do you pick which articles to use. We talked about the inclusion and exclusion criteria, and it's okay to change your mind, by the way. So let's say you take out the duplicates, obviously, and then you take out some of the ones that don't fit, and then you get down and there's only 2. You're like, okay, well, we can't do 2. We need to do more than that. So you go up here and you put some in the back into it, and you reshuffle the deck and see how it goes. And so it doesn't have to be an all or nothing, thing. This is not, all or nothing thing. So you can go back and change it. The next thing that I want to talk about is collecting the data. And this is, let's see if I can make this larger. So I'm just, can you give me a thumbs up if you can see this big chart? This is table 2.
Yeah, we can see it, and it's nicely zoomed in. Yeah.
Perfect. And so the advice I give to the students is this chart was probably 5 times bigger while they were deciding. So you can see that they collected age and they collected the gender and ethnicity and insurance, but they probably had other things in here, geography or concurrent illness or some other things. And they're like, well, there wasn't enough stuff to include those. And so they just trimmed them off. And while they went through, they probably saw, wow, they all kind of talk about insurance. And so now I'm going to add insurance. And so the point of showing you this chart is, this is also a very fluid process where you make a Google sheet and you fill in your best guess, and you kind of just start filling it in. So for the purposes of this is what are the things that matter most for someone following up their CAT scans to look for cancer? So in case you didn't know, like making an appointment to get a CT scan can sometimes be a pain in the neck. Sometimes you forget. Sometimes the radiologist, me, would say, oh, I want you to come back in 6 months or 3 months. And so they can get out of their routine. And so I personally think this is a great study to say, okay, what are some of the things that we can do to get people back in to make sure that they don't miss their scan to look for lung cancer? And so they picked these data points to look through. And so, of course, every one of your charts are going to include the source. Got it. If this is a medical or health related thing, as everyone in this group would be, I would expect there to be some demographic information, gender and age, ethnicity, sure, if it's appropriate. The reason why ethnicity is appropriate and race for this one is there is some disparity on the ability to get CT scans in some parts of the United States. And then there is a disparity in the education of who should get it. And so what I think they're trying to go down the path here is there a correlation with that geographically, with ethnicity, and with possible education of the general public to do this. So insurance is also another disparity here in this part of North America, down in the United States. And so while Medicare and Medicaid are the state-sponsored ways to get insurance, still not everyone has those either if they don't have private insurance. And so it's important that they kind of broke these out as well. The next ones are getting a little bit more specific to this exact study, because there's criteria to get a lung cancer screening. You have to have a certain number of years. You have to have, there's other eligibility criteria for that. And so we don't have to get into that, but that's something specific to this. But what I do like here is the eligibility criteria for each study have different ones. The National Cancer Screening, they use National Lung Screening Trials, they use CMS guidelines. And so this is a question that people have asked me for these studies for you guys is, what if they're different? And different is totally okay. You just put it up there and you say, these are the guidelines. And sometimes when you put all this stuff together, it's what you didn't find out that becomes most helpful. And when you bring it back to your discussion, you can say, hey, not everyone's using the same eligibility criteria. And I think that is a great future thing to do. So, those were the three biggest hurdles. Making sure you start out with the intended audience, like what do I need to begin with? How do I even do my inclusion and exclusion criteria, and how do I format the Prisma chart? And then how do you know what data to collect when you have 20 papers and you're like, well, where do I even start? And so that brings me to the fourth one, is just start. And I know it seems weird, but like if your Google Sheet only has one column, then great, start with one column and just have the source, and then read one of the articles. And if the article says, you know, age and gender and ethnicity, put those at the top of your Google Sheet, and then just keep adding the Google Sheet and make 50 things up there. And then as you read your second paper and your third paper and your fourth paper, you'll start to figure out what's the most important ones to keep. Another thing that's a little bit tricky is if I did it all myself, sometimes I have biases of how I read a paper. And I might say, oh, it's always important to have, you know, gender and age and ethnicity, but I might have forgotten something else. And so I think there's some benefit to having your teammates do this as well, blinded, where they have their own separate Google Sheet and they go through one or two or three articles and they make their most important things that they found. And then you guys get back together and say, okay, what are the most important things? And then go from there. And then I would say even switch, and then you read your partner's articles and they read your articles, and you refill in the Google Sheets just to make sure that you didn't miss anything. Because let's say, for example, on this first one, I didn't even know what the NCC guidelines were, and so I just left it off. But you do know that those are eligibility criteria. This is a way to make sure that nothing falls through the cracks, and so I would recommend that. And so you can see the theme of this kind of chat is, you know, just get started. And I definitely appreciate the phone calls that I've had with the students on this group, because they definitely did get just started, and that was awesome. And then it just took a little bit of guidance to get to here. So so that is all the main stuff that I have prepared for today. If there are any questions, I'm happy to go through any questions or any comments. So I'll pass it back, see if you guys have any questions.
So I have a question. So you mentioned how it's most productive to have multiple people reviewing the papers, so that of course you don't, of course, instill your bias and misinterpret, you know, the findings of a certain study. So would you recommend like a blinded reviewing process where you have like three reviewers that are reviewing the same papers, but they're blinded as to what exactly, like how the results were interpreted by a certain researcher?
So the short answer is yes. And in order to make it feasible, it has to be kind of in stages. So three researchers blinded to determine what you're even going to capture, and then agree, okay, three of us, I had 10 things, you had 12 things, you had 11 things. Okay, what are the things that overlap? Okay, let's choose the ones that overlap and put the 10 up to the top, or 11, or whatever numbers at the top. And so once we do that, now you'll go through all this whole list and fill in the chart. I'll go through the whole list, fill in the chart. They'll go through and fill the chart, and then there'll be gaps. And then you guys come back and hash it out and say, hey, no, they were saying the mean pack year was, you know, 40 or 50 or whatever, and then you guys can make sure you have the correct information. A lot of it is going to be pretty self-explanatory, but I mean, pretty obvious that you get the right answer. But there will be ones that aren't, and those are the ones that are important. Those are the ones that where there's some interpretation that's needed. And so to answer your question, yes. So I think it should be done blinded at least twice. One, to make sure you pick the proper variables at the top that you all agree upon, and then two, to make sure you populate the chart properly based on not bias from somebody else.
Right, thank you. And also in terms of, I guess, the pool of studies to examine and look through. Now, of course, I understand that this, of course, depends on the topic that you're exploring, and also depends on, of course, the pool of literature out there, of course, about your topic. But in general, is there like a number that groups should strive towards, like a golden number or a golden standard? Or is it more about the quality of the studies than, the quantity?
Yeah, I guess there's not a definite number. And so for me to say 15 is too small on this one is obviously a bit arbitrary. I would have to defer to each question that's being asked of the literature. And so if you have an awesome question that's just never been addressed and you only can find 2 or 3 articles to like really dig in and get started, I mean, that could like change the shape of healthcare just because there's not that much stuff and you thought of an awesome question. The converse is if you have a question that has been asked quite a few times, should people be screened for breast cancer? Like there's a lot of studies on there. And so you need to have, lots of studies to support an answer one way or another. And so I think, the answer that everyone doesn't like in medicine is you need to have enough. And what's enough? And enough is going to be to answer what you're trying to prove. And so this is kind of like the feedback loop of research is, you're going to test and iterate and test and iterate and test and iterate. And you might come down with just a couple studies, but you've figured out a really nice question and problem to solve.
And another, I think, like area that I think a lot of researchers struggle with, at least I've noticed so far, is deciding on like the inclusion and exclusion criteria. Of course, that comes down to the topic they're exploring. But I found that, like in regards to like the publication date, looking at the number of subjects involved in the study, looking at the exact method that was used, whether it's like a quantitative or qualitative approach. But what are some, I guess, major, categories to kind of screen the studies through and to kind of make sure that you are like heedful of these qualities to make sure that you have the best, most quantitative, most substantiated studies to actually analyze for your research?
So this is another really important question, and I kind of think of the Prisma chart as like a living document in that sense where, I mean, it would be one thing for me to say, okay, you should always exclude these, but that's not as helpful as you have this little bucket over here of exclusion and you pull out these 74 and you see how this number kind of changes. And then you start doing your Google sheet and you start filling it in and you're like, wow, this is not the answer I was hoping for. Then you go back up here and you put your 74 back in and you come back down and you do it again. And you're like, now we're starting to see a trend come out. So, so I think the better way to think of it is like, what's your question? So this one is, how well do patients stick to lung cancer screening? And so like a basic science, like what is the basic science behind the actual like neogenesis of the cells? Like that's not helpful. And economic study, they didn't think was helpful. I personally think risk modeling might have been helpful, but they didn't. Obviously not lung, not adherence. And so whatever your question is, that's what's going to guide what you're going to take out. And so one of the very popular questions that I've gotten with some of the students in this group is, I'm not sure if I should take it out. And that's where it comes where I was saying, like, just either take it out or put it in, do the work, fill out the Google sheet and remove the ones that you don't need. And so obviously that's where the benefit of, having the source on the side of the Google sheet, because you can put a little asterisk or a little circle in the margin and say, I'm not sure if we're going to keep this one or not. And then if it doesn't kind of make sense with your team, then you take it out and you go back up and you adjust your Prisma chart. And so, I mean, I was the same way. Like when I was doing research 20 years ago, I'm like, just tell me what to do. And that's the whole not nature research. The nature research is figure it out yourself. And so the best I can say is it's okay to be frustrated and it's okay to just try. And as long as you're willing to keep trying, then you'll end up with the data that you feel comfortable displaying. And then the publisher will decide if you did a good job or not. And so that's the whole nature of it. So it's okay to not know, and it's okay to iterate a lot of times, and it's okay to get frustrated.
Yeah, and I've also noticed that a lot of groups will basically select studies that were published within the last 10 years, which I think is a good, strategy given the fact that they're recent and they actually, account for all the recent findings. And then also, in some cases, they have decided to kind of select the studies that have the highest impact factors, which is also an interesting approach. But whether, of course, that is valid or not is definitely something to kind of ponder and think about. But in terms of, I guess, the Prisma chart itself, now a lot of the groups use the Prisma template that's like offered online. I think you can easily search it up and find it. But in terms of like, I guess the different stages, because some tend to spend a lot of time finding the studies and screening through them, and then other groups tend to spend more time on kind of separating the good studies versus the studies that are not as relevant. Like, what would you recommend in terms of just allocating time? Should we allocate more time towards like finding more studies, or filtering through all the studies that you've collected within the pool?
Once you have your list of studies that you're going to look at, then your clock is ticking. And so I because from that time you say, okay, we stopped collecting articles and we start moving forward, you want to kind of be done. And so I think depending on how big your team is and how serious you take this kind of project, like I would spend a lot of time trying to fill the top of the funnel with as many as possible. And if your team is big enough that you can have people also taking out stuff out of the funnel at the same time, then that can be helpful. And so taking it out of the funnel doesn't mean you're never going to use it. It's just saying I'm moving out to this side and I can save it for later. And so, so for example, let's say, there's a team of 4, everyone is on, Medline and Web Science and Google Scholars and all of them, and you guys are just searching, and you get to 500. Then I would take one person out of that group and say, okay, you start going through some of these, while the other 3 look for another 100. And then once you get like another 50, then you peel off another one and they start going through. And then once they really they can't find anything else, now all 4 get switched to now going through these and trying to screen them out. And then similarly, once you get it down to, we got it down to 20 or 40, peel off one person and start making the Google Sheet. And then they start filling in what are the things we're going to look at, and then you kind of waterfall down and peel down there too. So this again, it's not like a cookie cutter thing, but that's how I would run like a 4-person team of prioritizing what to do and how to kind of move fast.
Yeah, that's definitely an effective strategy, and I think that a lot of groups have tried to do that, but in some cases they've been limited by just the number of researchers available to help out with screening through all the studies. And also, just to kind of move towards, I guess, meta-analyses and the quantitative approach, a lot of our researchers have found, the stats like aspect of meta-analyses to be pretty intimidating, and they're not really sure what program they should be using, like SPSS or R Studio. So what would you recommend in terms of like guidance and how to really start a meta-analysis? Since I found that a lot of groups were really trying to develop something that is quantitative because it tends to hold more rigor and more value. So what would you recommend to kind of guide these researchers?
That's a great question for a couple different reasons. If someone's going to try and get something published in Nature or JAMA, you need a PhD statistician. Like there's no substitute for that. And so unless there's a PhD statistician like on your team, then you have to find one. And so if you're at a place that has an institutional review board that does actual research, they probably have a statistician that's an advisor to the IRB, and then you can work with them, usually at least enough to get you like in the right direction. One of the things that I've noticed in the last 2 or 3 years are the gig workers on Upwork and Fiverr. So Upwork.com, Fiverr.com, like literally there are like data scientists, PhD statisticians on there. And for a small fee, like $20, $30, $50, $100, you can send them your data and they'll run it through the most appropriate statistical analysis. Now, I know, students are on a budget and but but hiring a freelancer at that rate is about the best thing I've ever seen. And so I've personally used them for other kind of entrepreneurial projects where I needed to have some real statistics done. And I was very surprised at how professional they were and how high the quality was. And so you almost definitely can't get something published in JAMA by using that method. But I'm just saying this is a way to bridge that gap unless you have access to a PhD statistician. So that unfortunately is a pretty big hurdle for most people to get real research done, because you brought up a couple examples, SPSS and R are great ways to do it. But if those are the wrong platforms to begin with, then you're kind of just really banging your head against the wall. So I would seriously consider looking at Upwork.com or Fiverr.com. I have no relation to them, but I've been very happy with the type of work that they can do.
Yeah, I don't think I ever really considered that, but a lot of them, as you said, are data like analysts, scientists, so they have a lot of experience and they are quite professional. So definitely a helpful tip for all the researchers looking for help. Yeah, so I think that's all that I have in terms of questions. If the other participants have any questions, feel free to share them. We might have some questions in the chat, maybe.
I have one question. Okay, so going back to the topic of filtering out studies, is there a software we could use, or do we just need to do it manually?
See, great question. So right now, manually, the software would need to be pretty sophisticated to use natural language processing to look at the text and take out the things that you, the human, want or don't want. And so you can try and use some sort of filtering stuff, but I haven't seen anything nearly sophisticated enough to do the stuff that we're talking about here. Now, once that's in place, like once NLP is that far along, then you literally could ask a question. It would search all the data and just answer it for us. That would be genius. That'd be awesome. But we don't quite have that yet, at least not the level that I feel is useful. If you look at NLP medical data research, like if you Google that, you'll see many people trying to do that. But I haven't seen anything useful, not for this level yet. But great question.
Right. Thank you so much.
There's also another question in the chat. So in terms of how you said, if you have a great question, but there is not a lot of research done out there on it, how would a group be able to combat that?
So you would have to be able to back up that it is a great question. And is the fact that there's no research out there indicating that it's just a bad question? Unfortunately, sometimes there are. Or is the research out there that it just never was thought of in that way before? And so like social determinants of health, are the things that are determining like our health that are on more on the social scale. Your income, your access to fresh food, your access to fresh air, your access to fresh water, like all these other things, secondhand smoke, safety in the neighborhood, like these are all things that are reasonably new on the scene from a medical research standpoint. So if you said, what does social determinants of health have to do with juvenile onset diabetes? Okay, there's probably a lot on that. But what if you said, what does it have to do with juvenile onset allergies? Maybe there's not a lot on that. And so sure, so now we have a new thing, social determinants of health, an old thing, allergies, and there's just not a lot of studies on that yet. And then we could say maybe there is a huge thing with, if you're super stressed because you live in a dangerous neighborhood, you're more likely to have allergies. Perfectly reasonable hypothesis. Maybe that hasn't made it to literature yet. And so let's say you did that. Let's say you picked social determinants and allergies, and you found 3 papers, and you think that they have a pretty good base to support this. Then you can very easily say, hey, these 3 agree that we should look into social determinants more. And so then you can just expand on what they talked about in the papers. And so the kind of summary statement here is, you have to, yeah, it's back on your plate again. If you look at the 3 papers and they're all like, it wasn't worth it, it wasn't worth it, it wasn't worth it, you're gonna have to think of something else, because we've had 3 people that said it wasn't worth it. But if you get 3 papers and 2 say it was worth it and 1 that wasn't, now you have something to work on, and you can try and make a case to do more research. And ultimately, like that's one of the whole reasons why we do the systemic review, is to try and like crowdsource and get a little bit more scale. And so it's a little bit cheaper, a lot cheaper than doing like a double-blind placebo-controlled trial. So that is kind of thing, like how can you push the research further? So I think the answer is the question, are there only a few because the question's bad or the question's good? And then that's up to you as the researcher to figure that out.
Thank you so much.
Sure.
All right, I think that's everything.
Awesome. Well, I'm very happy to have a chance to hang out with you guys. We can do it again if I get another batch of similar questions. I had so many questions about this. I thought this would be a good topic. So we can stay in touch and do another one if needed.
Thank you, Dr. Vachon, for your time, and thanks for answering all of our questions.
Awesome. You guys have a great day.
Enjoy the rest of your day. Bye.
Bye-bye.